welcome back to Breaking Down Nursing, where we take all those intimidating machines and settings and make them simple. Today it's all about ventilators, essentially a very fancy, very smart air pump. Think of it as your patient's personal air DJ, mixing the perfect amount of breath to keep the party going. There are 4 key components to your vent settings. First being FiO2, or fraction of inspired oxygen. The second one you need to know is your PEEP, or positive end expiratory pressures. The third is respiratory rate, and the fourth is TV, or tidal volume. FiO2, or the fraction of inspired oxygen, is the percentage of oxygen the ventilator delivers with each breath. Let's talk about PEEP, or positive end expiratory pressure. So PEEPs are not the little pink bunnies that we eat during Easter time. PEEP is a really important part of our ventilator. And so the PEEP itself is a positive pressure at the end of the respiratory cycle. So next on the docket is respiratory rate. This is how many breaths the respirator gives per minute. The rate can be set to help your patients breathe faster or slower. Last but certainly not least is tidal volume. So this is the amount of air the ventilator gives your patients with each breath. Typical tidal volume for an average adult might be around 500 mLs. But it can be customized based off of the patient's size and lung conditions. The taller the patient, typically the larger the lungs. If the lungs are stiff, we might have to dial down the volume because we want to decrease the risk of trauma to the lungs. Thanks for joining us on Breaking Down Nursing. If this video has helped you understand ventilator settings and maybe even made you laugh a little bit, don't forget to like, subscribe, and hit the notification bell for more nursing insights. Until next time, keep calm and keep breathing. Or let the ventilator do it for you. Have a good one.